Welcome to Impact OC, the only program showcasing the people and organizations shaping Orange County. With your host, Don Camber.
Hello, I'm OC Talk Radio Public Affairs Director Don Camber with another great guest impacting our community in a positive way. February is American Heart Month and a time to focus Americans on heart health. Today, I welcome Interventional Cardiologist Dr. Pranav Patel. He's Chief Division of Cardiology School of Medicine, UCI Health. He's also American Heart Association Orange County Division Board President. Thank you, Dr. Patel, for being on Impact OC.
Well, thank you, Dawn, for having me. And hopefully today we'll talk a little bit about the American Heart Association and maybe even save some lives in Orange County. I think that's going to be important.
Well, Dr. Patel, please tell us about the focus of American Heart Month and National Wear Red Day.
So National Wear Red Day, and this year, this is going to be February the 3rd. This is this coming Friday. And really what we're trying to do is recognize people who've been affected by heart disease and stroke. This is the biggest killer of adults in this country. And I think nearly everyone is impacted, whether it be friends or family. And we encourage people to wear red on that particular day.
What is cardiac arrest, and is it different from a heart attack?
Yes, cardiac arrest basically is an abnormality with the rhythm of the heart, the electricity of the heart. And when you have this abnormality with that electricity, the heart doesn't work too well, it doesn't function, it doesn't act as a pump, and then that reduces blood flow to the organs, the brain, the lungs, and ultimately it will cause death. And more significantly, it causes something called sudden cardiac death, which is immediate death unless we treat it immediately. A heart attack itself is lack of blood flow to the heart, which is a muscle, and blood flow through the blood vessels that supply the heart with blood and oxygen. Now, that's a heart attack, and the heart can keep functioning as a pump when someone has a heart attack. With cardiac arrest, it doesn't function, and I think that's the important thing to remember.
So what does someone do? Is there a way you can revive a person who suddenly goes to sudden cardiac arrest?
Yes, the important thing to do is to perform chest compressions, or in medicine we talk about CPR, which is cardiopulmonary resuscitation. But in the community, and this is what the American Heart Association wants to talk about, I think if you are an adult, if you're a teen, we would like everyone to know how to do chest compressions or CPR. And that's our goal, is to get this out there and educate the community because we want to save lives.
Can you explain what that is?
So we have, a program which is called Hands-Only CPR. And this is really a two-step process. We try to keep it simple. So the first thing to do when someone collapses and they're not breathing and you're worried about cardiac arrest, first, either call 911 or get someone else to call 911. The next thing you do is you perform chest compressions. It's really just, put one hand on the chest, the patient's chest, put the other hand on your first hand, and then just compress the chest. And you want to do, between 100 to 120 chest compressions a minute, and just keep going until the ambulance arrives. I think that's the goal. What you want to do is you're using those compressions to help pump the heart and pump the organs, the brain, and the lungs with oxygenated blood. That's the goal.
What are the signs of someone's going through sudden cardiac arrest or a heart attack?
Well, a heart attack, the more common symptoms are things like chest discomfort. Someone may clutch their chest. They may have shortness of breath. They may complain about chest pain radiating to the jaw or the arm. They may not collapse. Sometimes a heart attack can cause cardiac arrest. It can cause that electrical abnormality. And that's what kills someone during a heart attack. Now, cardiac arrest can have many causes, including a heart attack. And most of the time, this electrical disturbance with the heart will cause someone to collapse right away. You'll lose consciousness. And your heart's not working. You don't have a blood pressure. And unless you get that heart pumping by this external force of chest compressions, the patient's not going to survive. Actually, more than 70% of cardiac arrests actually happen outside the hospital. They occur actually at home. And 90% of these individuals don't survive. So 1 in 10 people who have cardiac arrest won't survive. And this is important that people start thinking about this and think about the hands-only CPR, because it can save lives.
How soon does a person need hands-only CPR in order to survive a sudden cardiac arrest?
The sooner the better. The sooner the better. Actually, you know, one of the reasons I've pushed for this, and it's been important to me, certainly in the field of medicine and cardiology, but one thing that sort of hit at home was many years back when I began my career, I was in the ICU looking after patients, and we had a very young patient, only 15 years old. She was in an athletic meeting and had collapsed, and she had cardiac arrest. Don't really know why, but the ambulance were called, and it took them 15 minutes to get to her. But at that time, the adults and even the teens around her did not do anything because they had no idea what to do. By the time she got to us, she'd received CPR, but it was a little too late. So every organ was functioning by the time she got to me, even the heart. But lack of CPR meant that there was no perfusion of blood and oxygen to the brain, and she was brain dead. And this could have been something so simple. If someone had just given her CPR, she could have survived. So these are simple things, and I think we just sort of get that out to the community so we can save young lives.
Dr. Patel, you did say as soon as possible. Can you give me a timeline on how quickly a person should have CPR?
If someone collapses in front of you, you get to them immediately. Seconds count, minutes count. And we would like someone to at least perform CPR within 3 minutes. I mean, that's the goal. But as soon as someone collapses, you call 911 and start CPR.
Now, there's the hands-only CPR. There is the other way of doing CPR. Is that still done?
Yes, in the past, and we've seen TV shows and films where you have to give breaths to people. We no longer recommend that unless you're a trained expert. So, this is talking to the everyday person who's not a medical expert. All you have to do is give chest compressions. You don't have to breathe for the patient or anything like that. And then, let the ambulance experts come. EMT will come, and they'll know how to take over after that.
So ultimately, chest compressions until an emergency unit arrives to take over.
Correct. That's the goal.
What about an AED?
So AED means automated external defibrillator. And so a defibrillator is a device which will give a little shock to the heart. And what happens there is that cardiac arrest is an electrical abnormal heart rhythm. The defibrillator will shock the heart into hopefully a normal rhythm. So we see these everywhere. We see them at schools, in airports, bus stations, that sort of thing. And the reason we see them everywhere was we know that we have to put them on a patient and shock them as soon as possible. So these are available. Sometimes if you witness some episodes, if you're in a building or in a public location, certainly ask someone to call 911 for you, start CPR or chest compressions. You can also ask, is there a defibrillator, automated defibrillator around that we can use on a patient? And those are simple to use. There are instructions on them which make it very clear as to how to use them.
Would that take the place of compressions?
It doesn't take the place of compressions. So compression need to continue. And approximately every 2 minutes, you would think about looking at a defibrillator, and the defibrillator will look at the heart rhythm and shock if needed. But the chest compression should continue.
So you continue that and do the AED at the same time?
Exactly. You do the chest compressions, and after a couple of minutes, you can put the AED on, or you can certainly put it on while you're doing the chest compressions. And then you take a few minutes to look at the AED. We'll try to identify the heart rhythm. It may not need to be shocked. If not, you just continue CPR. If the heart needs to be shocked into a normal rhythm, it will identify it and shock the heart. And if you can get a pulse back and a blood pressure and the patient starts breathing, you don't have to continue. But if not, it will tell you to continue CPR. There's an automated voice will let you know what to do.
How young can a person be to do compressions and or AED?
Well, I think that, we're looking at the youngest as being teenagers. They can understand what's going on. They can understand what's identified in terms of the AED and its instructions. And there's no age limit for the older you get. I think the older you get, you can still do chest compressions. And certainly if you have access to an AED, again, I think it's very simple for most individuals to understand how it operates, but nothing beats chest compressions if you don't know what to do.
Are there different signs for cardiac arrest for women and men?
Cardiac arrest can be very different for men, women. I think what will happen is that you lose consciousness and you're going to collapse. And if you're not breathing, then I think you start doing CPR. Okay. Now, there is a concern because I think the treatment for women is a little different. There are actually disparities between how we treat men and women. And one of the thoughts was that if a woman collapses with cardiac arrest, there's a concern that, should I be doing CPR? Am I doing something wrong by giving chest compressions? Women in our society tend to be smaller than men. Am I going to hurt a woman if I give chest compressions? Is there going to be issues, unfortunately, of sexual assault, that sort of thing? I would say, if it's a woman and you feel that this is cardiac arrest, give chest compressions because they're less likely to survive a cardiac arrest than men.
Where can people learn these chest compressions?
Well, certainly the American Heart Association has various sources online where you can learn chest compressions. But in these days, you can find it anywhere. You can find it online if you Google. You can go to YouTube channels that show you exactly what to do. And certain medical centers, even in certain schools, you'll find information how to do CPR. You can get certified just like medical professionals to do this and get recertified every 2 years. But simple chest compressions and the hands-on CPR that we spoke about in the American Heart Association is something that everyone can learn.
Do you think there's a chance we can be in a world where a lot of people know it so that less people will die of sudden cardiac arrest?
I mean, I think so, and I pray that happens because it's such a simple skill. We were talking and we said that as we were growing up, when we were younger, our parents and school teachers told us and taught us how to cross the road. Look both ways. I do this with my 6-year-old now, but we can do the same about hands-only CPR. It's a simple message and a simple lesson. This is something that I think we can teach everyone, and this is something that our kids will teach their kids in the future.
What can people do to avoid cardiovascular disease?
Well, there are many things. There are risk factors for having cardiovascular disease. And some of the more common risk factors in our country tend to be tobacco use, diabetes, high blood pressure, high cholesterol. So a routine checkup with your primary care physician helps. There's also a family history. But the simple things we can start off with are things like nutrition, good nutrition, exercise, daily exercise. I tell my patients who tend to be in their 60s and 70s and who tend to have heart disease, you know, minimum recommendations for exercise is walking 30 minutes a day, 5 days a week. I think we can all try to do that, even in our busy schedules. I see at the medical center where I work, people on their lunch breaks having lunch, then walking for 30 minutes, an easy way to do this. And regular exercise can help prevent a future cardiac event by up to 20 to 25%. Um, Nutrition is important. Um, and I try to keep it simple. I just help my patients, eat everything in moderation. Most people know what to avoid. I'm not going to tell them to avoid all fried foods, avoid going out to restaurants. We don't want to remove the pleasures, simple pleasures of life, but everything in moderation. Exercise and eating in moderation is something we've over the years we've forgotten, and these are things to keep in mind.
Do you believe cardiovascular disease is avoidable?
I think so. We've gone very far. Um, Now it's cardiovascular disease, and I'll put stroke in that category as well. Heart disease and stroke are the biggest killers of adults in the United States. Now we've gone far when it comes to medicines and procedures to help with this, but we can still do better. Um, I saw some data recently where the French, they smoke more than us, they drink more than us, but they have less heart disease because I think they tend to exercise more than us, especially in, let's say, Los Angeles or certain areas in Southern California, Orange County. We don't walk like we used to. The car's our friend. Um, so there's simple things that we can do, in terms of reducing our risk factors. And actually, we're the generation below us, the younger generation, is doing very poorly. The prevalence of juvenile diabetes and obesity is on the rise. So we will see, this problem increased quite a bit with future generations. So
Why is that?
you know, um, there are things like fast food becomes more prevalent. It's cheaper, it's easier sometimes, um, but it's not as healthy. Um, Cooking at home, you have more control about what you put in food. And again, that doesn't mean not going to restaurants and eating fast food, but you should not be eating it every day. And going outside and exercising, 20 years ago, we all joke that parents had a tough time bringing their kids in back home after playing outside. Now it's the opposite. The kids are playing on their iPhone or iPad or on their computer at home, and no one's going outside to exercise. So these are all things that we need to think about. And, we need to think about changing our lifestyle for the better.
Why are you passionate about educating the public about cardiovascular disease?
Well, I think as a physician and a health professional, I think we need to improve this, right? It's by the time I see a patient in the hospital and I'm doing a procedure for them, it's a little too late. And I've been impacted not only by patients, but I have a family history of heart disease. So I can see the impact, and especially when, younger people pass away or, family members, especially younger family members who should have had a more fulfilling life pass away, I can see the changes that need to be made. And some of these things are very simple changes, you know, and if we can't make these changes, at least we can learn skills where we can help family members or friends, maybe save a life, and maybe save the life of someone you don't know, which is, I think, even more rewarding because you were there, you learned these skills, you were able to do chest compression, understand a little bit about CPR, and just save a stranger's life. I mean, I see that on a daily basis when I see strangers come to my hospital and looked after by myself or my colleagues. Um, Patients' families sort of give you thanks and you appreciate that. and it means a lot. And I think that if the regular community, our own community realize that, they'll really learn those skills and appreciate those skills.
You're an interventional cardiologist. What's the difference between an interventional cardiologist and I hate to say regular, but a regular cardiologist?
Well, so a general cardiologist and an interventional cardiologist. I've had at least a couple of years of extra training, and what I'm able to do is do procedures where, for example, if someone is having a heart attack from a blocked blood vessel in the heart, I'm able to open up that blood vessel and stop the heart attack. And there are other procedures we're able to do. We're able to actually replace certain heart valves without opening the chest. We're able to replace them by going through a blood vessel in the leg. So technology is sort of improved, and we're trying to keep up and with technology and using this technology to help patients with their cardiovascular diseases. So that's really the difference between a general cardiologist and an interventional cardiologist, where I'm doing more invasive procedures in the body.
What's the average age someone develops cardiovascular disease?
So cardiovascular disease, and if we simply talk about atherosclerosis. Atherosclerosis is a process where we develop cholesterol deposition within the blood vessels of the heart. Research had shown that we start developing cholesterol deposition at the age of 19. So the age of 19 is when you're the healthiest you're going to be. And then with every decade after that, we develop more and more. Now, it may be very, very mild at 19. It may be very, very mild at the age of 40 and 50. But then you start developing risk factors, and you may have high blood pressure by then. You may develop diabetes. You may have a family history and, in fact, have high cholesterol. You exercise less. Maybe your diet is not as good as it was if a decade ago. So the risk factors increase. And so, for men after the age of 55, for women, after the age of 60 or 65, those risk factors increase, and those cholesterol, that cholesterol deposition increases, and there's a chance that you have significant blockage and a risk of a heart attack. And the same sort of physiology works with the brain. That risk of a stroke sort of increases as you get older.
Again, Wear Red Day is coming up. What would you like people to do?
I would like people to wear a little bit of red on their outfit. It could be a red tie, a red scarf. You don't have to wear all red. At UC Irvine, we have red ribbons in the Division of Cardiology that we hand out to people to wear on their lapels. But it's just a recognition of heart disease and stroke. It impacts everyone, whether we like it or not. And this is not only to recognize people who've had this disease and passed away from it, or have this disease and have survived, but also the family members who've been impacted by this. And to keep in mind that in the future, other members of the community will be affected, and there is a chance that we could positively impact their life if we think about, can we learn hands-on CPR? Can we think about the risk factors and reduce the chance of someone having a heart attack, possible cardiac arrest, or someone having a stroke in the future?
And Wear Red Day is?
This is February the 3rd, which is this coming Friday.
And so you hope people will wear red in order to bring attention to cardiovascular disease.
Exactly. That's the goal. That's the goal.
Thank you, interventional cardiologist Dr. Pranav Patel, for being on Impact OC. And I thank everyone for tuning in. I'm OC Talk Radio Public Affairs Director Dawn Camber. Have an impactful day.
You've been listening to Impact OC, the only program showcasing the people and organizations shaping our community. Right here on Orange County's only community radio station, OC Talk Radio.